Good
Okay.
morning, everyone.
Can you hear me?
Am, are you trying to say something?
I am. Can you hear me?
Can't hear
No?
you.
Okay, thanks.
Think you're on now.
Can you hear me now?
Mhm.
Okay, great. I just wanted to have you maybe give a shout out for the Survivorship event while we're waiting for everyone to join.
Yeah, that's a really great idea to let everyone know we are having an exciting event coming up with Cancer Center Survivorship and all everyone in the Cancer Center around navigation and cancer survivorship for survivors on June 26th, 9 in the morning. We'll be featuring speakers from our own cancer center, as well as a panel of our program cancer survivors, pre-survivor, and caregivers, really highlighting their stories and the importance of our program and what it brings to patients. So that's going to be very exciting. Everyone look out for the invite.
And let your patients know about it too, because we would love to have patients, caregivers, anyone who's interested attend. It'll be June 26th from 9 to 12, I believe. Great. Thanks, Debbie.
Thank you, Pam. That's a great idea. If I believe everyone mostly knows, but Pamela Ganshow is our Director of Cancer Prevention and Survivorship. I will talk about her a little bit more in my talk. I'm just pulling up my slides here. I'll share my screen with you all.
And while Debbie's pulling up her slides, if any of you are interested in participating in the event or presenting in the event, or you know of patients, please email Debbie or myself with your ideas or your patients that might be interested, or caregivers that might be interested in participating.
Definitely. Thank you. Okay. So I wanted to speak to everyone today about integrative medicine. I'm so glad so many people were able to show up to this talk today. This has been something that's been very integral in my training and my career here at UIC now. In residency, I got introduced to integrative medicine. Hold on, I'm trying to advance slides. It's always trouble. And I was encouraged by my program director of my preventive medicine residency, Dr. Pamela Ganshow, to participate in this faculty scholars program in integrative healthcare. This was through the Osher Center for Integrative Medicine at Northwestern. And it was a really rich experience that monthly we've really got to take a deep dive into different aspects of integrative healthcare and how those helps people to achieve wellness and well-being in their lives. And I believe this program, I believe it's probably gone virtual. You can find out more. If you have questions, you can ask me, but this is sort of where I learned where my roots in integrative medicine came to be. So, but today I'm going to build on that training a little bit. I'll define and provide a little history of integrative medicine and talk about various approaches of integrative medicine, specifically how each of the practices can assist cancer survivors, and then discuss what's going on right now where we are at. So what is integrative medicine? There's a lot of confusing terms, all these different types of quote unquote medicine that kind of blurred lines. So conventional medicine is the Western medicine. It's the chemotherapy, it's the drugs and the surgery, and it treats symptoms very directly like that. Alternative medicine is a term that's used to describe the whole range of things, but this term is kind of shied away from in integrative medicine. They call it integrative because alternative kind of suggests that it's instead of traditional Western therapy. But you'll see that integrative medicine recognizes that these need to work together. Complementary medicine is kind of in between, also talking about combining different therapies. And functional medicine is a discipline that looks at the root causes for disease and focuses really on prevention and really getting down to the nitty-gritty cellular level processes that are responsible for maladaptations of the body. But like I said, integrative medicine is really a holistic approach that combines this conventional medicine along with these other different types of therapies that really helps to improve patient quality of life and well-being overall. There's this integrative medicine wheel that shows all the different disciplines and that they all are interrelated and help to holistically treat patients. There's this great program founded by Andrew Weil. He's one of the kind of founders of current integrative medicine and kind of more, if you will, has sort of sold out in a way because he's very popularized. But he founded this great fellowship program that trains people in integrative medicine at the University of Arizona. And their definition says it's a healing-oriented medicine, takes account of the whole person, that holistic kind of picture, taking into all aspects between the practitioner and patient relationship being very important, informed by evidence-based practices, and it has all appropriate therapies. So I'm going to talk about some of that. But the history of integrative medicine actually starts way back when. The origins of medicine were derived really thousands of years ago from culture and religion in mostly observational ways. Mostly priests would be the ones practicing these types of practices. In Mesopotamian Egypt, 3100 BC, came the practices of aromatherapy and reflexology, actually. Then a little later in India, about 2500 BC, the Ayurveda came into being, and the Vedas being just different ways to heal and treat the body with the body's life force. Yoga, another practice that became popular then, and Unani medicine is kind of not talked about quite as much, but it also focuses on this kind of holistic wellness with mind and body. In China, around 1600 BC, traditional Chinese medicine came into being. It's kind of questionable that some of these origins were actually earlier, and we'll dive into that. Then in 800 BC in Greece, Hippocrates, he popularized using food to achieve health and healing, and then also development of many herbal types of therapies, and as well as medicines. Then things get kind of fuzzy for a little while. Medicine really transformed. It became more scientific and it became more directed. So it traveled around from Rome into Iran to about 1900 AD. And in Europe in the 18th century, the homeopathy was actually developed. And it was developed in opposition to Western medicine, which was being developed, and kind of reeling it back to show people that there are different ways that we can treat the human body. In the 19th and 20th century, there was development of chiropractic medicine and osteopathic medicine. And as I said, Andrew Weil kind of picked up and made it popular in the 21st century. Integrative medicine now kind of has a little bit of a face. So I want to focus the meat, really, most of this talk on these approaches, because with integrative medicine, it's really important to build a very robust toolbox, if you will, to have multiple different approaches, because those approaches may work in different ways for different patients at different times. So these kind of fall into about 3 different categories. There are some blurred lines, but I'm broken this talk down into mind-body practices, ingestibles, or things that are consumed, and traditional Chinese medicine practices. So as far as mind-body practice, these are things that combine mental focus, controlled breathing, body movements to relax the body and the mind. They can help control pain, stress, anxiety, depression, and for overall health. In National Cancer Institute actually have a pretty big dictionary of all these terms. I really like their definitions for these things. They recognize all of these practices as well. So first, I'll talk about mindfulness and meditation. And this is one of those blurred lines things, is that a lot of mindfulness is meditation, a lot of meditation is mindfulness. But the best kind of breakdown that I saw was that it's an awareness of something versus nothing. So you're aware of your body with mindfulness. You can do it at any time and you kind of focus on your body, like with a body scan, going from top to bottom and relaxing your muscles and noticing what might be stressed or tense. Or there are other mindfulness practices like non-judging, beginner's mind, and trust or gratitude, that you just make yourself aware of the things that are going on in your mind, in your life, and giving it credit and helping you to kind of build on that and learn from that going forward. Versus meditation helps you to kind of relax. You calm the traffic in your mind. You set aside some time for practice. It doesn't have to be seated cross-legged on the ground for 20 minutes. It can be where you're at. And these can be different types, like spiritual, mantra-based, meaning just repeating a short phrase or a word. You can have visual meditations, things like journeying. We actually, during the FSP course, journeyed with a shaman and visualized ourselves going through this tunnel. So there's also loving kindness and just telling yourself to be kind to yourself. And the thing I want to emphasize in this talk is that there is a lot of literature for these things. I'll cover multiple different studies. Here is a systematic review and meta-analysis of RCTs. They found 29 that included mindfulness-based interventions for cancer patients and survivors. And they did find a statistically significant effect of mindfulness-based interventions on psychological distress, anxiety, depression, fear of cancer recurrence, which is a very pervasive problem for cancer survivors, fatigue, sleep disturbances, and pain. And here you can see the forest plot, and all these studies, almost all the studies, favored the mind-body interventions. I'll run through these kind of quick, but I do have them all listed in the references at the end, and I'm welcome to answer any questions. So another study that was RCT of mindfulness-based stress reduction, it kind of gets it down a little more granular. It's one of those studies within that meta-analysis. And this actually was a control trial that recruited 322 breast cancer survivors. And they were assigned to either 6 weeks of the mindfulness-based practice or just usual care. And over time, they found increases in levels of TNF alpha and IL-6, which are inflammatory biomarkers. And first sight, you think, well, that's no good to increase the inflammatory biomarkers, but this actually may indicate a restoration of the immune response, as these are breast cancer survivors who have undergone treatment and might have a compromised immune system. So these mindfulness-based stress reduction activities are enhancing the immune system and making it better at fighting off cancer, infection, and improving wellness of the body. Hypnotherapy was something that I thought was very interesting. And this is a state of deep relaxation that helps people to reprogram or overcome different patterns of behavior that may be destructive or may be harmful to them. And studies have shown that it can be useful for multiple different things. Also, this can be performed for procedures a lot of times, especially in children. Hypnotherapy prior to procedures can be beneficial with managing anxiety. And this may be a little old of a study, but not a lot has changed with this. There was a very large narrative evaluation of a lot of different studies in the literature. And there was a lot of evidence there supporting the use of hypnosis in pain control, managing acute pain and anxiety in cancer patients, nausea and vomiting, and immobilization and anxiolysis in the radiotherapy suite. So patients getting scans, having scanxiety or MRIs that are not pleasant procedures to undergo, hypnotherapy may be an option for these patients. A kind of similar technique is guided imagery. This focuses the imagination to help kind of create a calm, peaceful image that provides a mental escape. And I remember in our class at Northwestern, one of our participants in the course was a pediatric anesthesiologist. And he said that they would help these kids, even they created virtual kind of platforms to engage and engulf the pediatric mind to be in a calming place, like a snowy forest, before they underwent a surgical procedure. And it was helpful in terms of pain control. And in this instance, it also can help reduce symptoms associated with cancer treatments and improve quality of life. And then this study, an RCT, looking at guided imagery and progressive muscle relaxation, typically bundled together. They found in this trial with 208 patients that had a 3-week intervention, and they completed assessments along the way that the mean anxiety and depression scores were significantly lower compared to the controls when having the intervention. So this is another one that was interesting. Notice that cortisol and amylase, markers of stress in the body, were actually decreased in the intervention group, but all increased in the controls. Mind-body exercises are really interesting, and they have a lot of overlap. I tried to find distinctive pictures here. Yoga practices are focused on muscular activity, but also self-awareness of where your body is and how your breath is going. Tai Chi incorporates a martial arts component to it, as well as Qi, and this is a concept of vital energy in the body, and you want a good steady flow of that energy, which Tai Chi kind of optimizes. Qigong is kind of similar, bringing together body and meditation practices, but also really focuses in on the breathing as well. So here is a study review of evidence-based literature on yoga in cancer care. They found a whole bunch of studies, over 10,000 patients in 20 countries. And yoga improved physical and psychological symptoms, quality of life, as well as, again, those markers of immunity. So they said that it's a good support for integrating yoga into traditional cancer care. And then a Qigong intervention, one of the mind-body exercises. Oh, I'm sorry, I didn't update this. It was another study. It was just a pilot. It was a small N, but they did find a benefit to cancer patients with insomnia and found improved sleep quality. And I'll update this before I send out the slides. I apologize. Breath work I find very interesting. So many yoga gurus, if you will, consider pranayama the heart of yoga, and being one of the most centering principles of the mind-body practice. If you break down, disambiguate this term, prana means the life force or breath sustaining the body. And then yama is to extend or control. So pranayama together is controlling your breath or controlling your life force to bring wellness. This has also been shown to relieve fatigue, anxiety, and depression. And the way it works is it actually activates the parasympathetic nervous system. It's really fascinating that this does that, but it's based on how much oxygen you're breathing in, because when we're stressed, we breathe too fast and our oxygen content goes up. And that will actually activate sympathetic nervous system and just increase that fight or flight idea that we have. But when we slow our breathing, slow our controlled breathing, we minimize that respiratory alkalosis that we are having and increasing the CO2 in our blood, which makes that all happen, which then does actually activate parasympathetic nervous system and acetylcholine response to then calm our body. And this, I thought, was a really great representation of how all of the different ways that the breath can be controlled. So this is what they're talking about when they talk about different options of breath awareness, directing breath to different parts of the body, and really controlling your breath either through your nostrils, different valves, different types of breathing. And there's really a bunch of different practices to find which one works for you. Here was a study on yoga breathing for cancer chemotherapy associated symptoms. It was a small pilot. There were 18 participants, and it was very difficult to kind of sham this, if you will. So the control was that they only performed the pranayama during one cycle of chemotherapy versus the quote unquote intervention was they practiced during two. And it was a really intensive, they worked with an instructor and they also did home practice. And over time, there were statistically significant improvements for the intervention in patients' reported sleep disturbance, anxiety, and their overall mental quality of life. So I thought it would be useful for everyone. I'm not going to spend a lot of time on this, but I thought this was a really nice, quick, easy meditation. Everyone can do this anywhere you are, any time of the day. It's called square breathing. You just think about this square and going around. You inhale 1, 2, 3, 4, and hold it for 4. Exhale for 4, and rest for 4. And repeating this cycle just a few times, just 3 or 4 times, is very calming and can really decrease anxiety, really helps with stress reduction. Maybe someone has an appointment coming up, a cancer patient has a scan coming up. So this is a technique that's really easy to learn and to teach anybody. And what can actually further enhance this technique and the calming effects is extending that exhalation. So if you make your exhale or the rest after your exhale, like a 5 or a 6, that will further activate the parasympathetic nervous response versus increasing the inhale or the hold is actually activating and energizing. So again, you can take this forward to all your patients, do this beginning of a busy day to help to center yourself and to help to calm that traffic and anxiety down. So next I want to talk about things that we put into our bodies. You are what you ingest. And diet, I mentioned Hippocrates, and he has that, timeless quotation of you are what you eat. We know that diet can influence cancer outcomes. There are many different specific regimens that have been studied, but evidence is really lacking for the benefit of anything that is specific. Really, overall, it's another holistic approach. We need to focus on healthy diet principles overall. And so I know I'm preaching to the choir here, but just thought this was a really great systematic review and meta-analysis on diet of 117 studies with an N over 200,000. And they found lower overall mortalities with an increased intake of fish and vegetables, decreased alcohol, and also they assessed the quality and the healthy dietary patterns that patients were following. Interestingly, they also mentioned that the Western diet was associated with a higher overall mortality. So I speak to almost all my patients about the Mediterranean diet as a beneficial diet that has a lot of really great principles that just overall help with wellness and health of the body. Herbal medicines, I didn't get into the nitty-gritty of every study of every herbal medicine because a lot of these have a little bit of mixed literature on them. Green tea may influence tumor behavior and overall survival. Again, some studies were good and some studies were a little bit less robust. Essiac was something I hadn't heard of. It's a mixture of several different herbal components and it has antioxidant, antiestrogenic, and immunostimulant and anti-tumor actions. So another option. Mistletoe was kind of questionable whether it has anti-cancer activities. And we have heard a lot about St. John's wort having a cytotoxic effect on tumor cells. So these are just some things that perhaps you might hear from patients, not anything to necessarily recommend to patients, and always something to watch out for with other things that patients may be taking, other medications they're on. And I'll talk a little bit more about some other cautions of these things. Non-herbals are interesting and can be very helpful too. Melatonin we know to help with sleep at very low doses, but it also may stimulate immune function and have an anti-cancer and antioxidant effect. In high doses, it has been studied in brain tumors, but again, not a lot of literature on this one. Vitamin D can reduce the risk of advanced cancer as well as cancer mortality. There was a 2020 JAMA Network Open article that looked at this and talked about the research. Again, that reference is included in the end of the presentation. And then fish oil is another one that can control cancer-related symptoms. And also, I was interested that it helps to control anorexia as well. There were others without very much literature at all that were mentioned, like shark and bovine cartilage, hydrazine, lycopene, vitamin C, and Q12 or coenzyme Q12, but these did not have very good support. Homeopathy is an interesting one that some of you may have heard of. It's based on the idea that like cures like. So if you have a substance that creates disease in very, very small quantities, if you give it to people who are affected, it'll actually cure the disease. So what happens is they'll take something from maybe a plant, an animal, or some other natural kind of material, and they'll water it down with water or alcohol and shake it up so that the essence of the healing factors is distributed. And it gets so dilute that there's not actually even any molecules of the original substance in it. But this is based on this law of minimum dose. A lower dose confers higher effectiveness. And these come from plants or minerals or animals, like I said. And this one is tough because there isn't a lot of research either on this one. But a small 47 patients with lung cancer compared using homeopathic treatments with a placebo. And they did show improved quality of life functional symptom scales in the homeopathy group, as well as an improved longer median survival time. So there were also studies that kind of said, no, homeopathy doesn't do anything at all. So this one to be taken with a grain of salt. So now talking a little bit about traditional Chinese medicine. This has been around for thousands of years, much far longer than any of our current cancer therapies in Western medicine. They use it to prevent, diagnose, and treat disease. It's based on the belief that, as I said before, this key vital energy in the body, it flows along these meridians in the body, channels that flow through the body for all the different organs. And this keeps a person's spiritual, emotional, mental, and physical health in balance. So traditional Chinese medicine aims to restore the balance and harmony between the natural opposing forces of yin and yang. So you can have a blocking of the qi, and this causes disease. So by opening up those channels and opening up the qi to flow through the body, then this can help to restore that balance and wellness. And so I'll talk about acupuncture here. This is, everyone knows, the stimulation of those specific points along the channels on the body by inserting needles into the skin. And these needles are super tiny. Here, I thought this image was really great that shows a matchstick hypodermic needle, sewing needle, and the acupuncture needles and facial acupuncture, or also auricular acupuncture needles, are very, very tiny. They're less than, oh, I'm sorry, I put in a typo there, 0.25 millimeters thick. And they only go a quarter inch or so into the skin. It really depends where on the skin needles are being applied to. Some areas are thicker tissue, if you can imagine something going in on your forearm versus up on your shoulder. It's kind of a little meatier. And this has really been shown to be helpful for pain conditions across the board. So acupressure is another one that's like acupuncture. So the little beads are used to stimulate these meridians or channels. And there's clinical evidence for improvement of cancer pain with acupuncture and acupressure. This was a recent study in JAMA Oncology with 14 randomized controlled trials that showed that the acupuncture and acupressure was associated with reduced pain intensity when compared to a sham acupuncture. And also they looked at it in combination with analgesia, a true kind of integrative complementary relationship. It also had potential to reduce opioid dose, which is very important for a lot of our patients who struggle with taking high doses of opioid medications. They found that the adverse events were minor, just a little bruising. And again, here we can see a forest plot with them favoring acupuncture or acupressure across the board on all the studies. And here's one that was popularized is within that review, the effect of acupuncture versus sham or weightless control for joint pain related to aromatase inhibitors among women with early stage breast cancer. This was a decently sized trial in 2018 with 226 women with postmenopausal early breast cancer who were randomized to one of these options. And they found a statistically significant reduction in pain scores at 6 weeks in the true acupuncture above all to sham acupuncture to controls. So this was generating more different studies as well. So, but this I thought was a good one to include. Chinese herbal medicine, a little like the previous herbal medicines, they can potentially reduce the toxicity associated with traditional anti-cancer therapies. Shosaigoto is liver protective And it has been seen in some studies to reduce hepatocellular carcinoma incidence. And one called astragalus, I hadn't heard of before, also works to boost host immune function. And then mushrooms, shiitakes and reishi mushrooms, do support immune system, and they also may have anti-tumor activity as well. I did find one study on the effect of the Chinese herbals on survival of colorectal cancer patients, but a specific subset with liver-limited metastases. I was curious on how they generated this research question. And they had 126 patients with a high exposure to Chinese herbal medicine, or that they were utilizing it for 6 or more months. And they did find these patients did have better overall survival when compared to the control group that did not have a high exposure, less than 6 months. And another one I wanted to plug, because I talked to a lot of patients about this, Kristen knows, I talked to them about singing bowls. This is a picture of my Tibetan singing bowl. It's on my desk right now. These are really interesting little tools that promote faster and deeper relaxation. It overall can enhance emotional and physical well-being. And how it works is oh, sorry, I was hearing a ringing outside. I will actually play my Tibetan singing bowl. It enhances the emotional and physical well-being, and sound vibrations can reduce anxiety and increase well-being. And at the beginning of each one of our FSCs, we would start it with a tone. So these are easy to get, $25 on Amazon, and they have been shown to have some benefit. They compared a group of patients using the Himalayan singing bowls to patients who were just laying down supine on their back and just being silent. And they found that there was a reduction in stress index, as well as heart rate variability, which is an indicator of stress as well. My suggestion, I just want to mention, because it's another popular traditional Chinese medicine practice, and this is using the heat that's generated by burning these small piles, if you will, of mugwort. It's not really burning them, but they kind of smolder on or near these meridians. Again, it's to improve this flow of qi through the body. And there were some studies that said it could be a potential adjunct for cancer-related fatigue, but then I found a couple of reviews that said none of the RCTs really have any valuable data. So, but this is kind of important to take me into the next step of my talk, is some cautionary words. Not all these practices are as good, well-founded as others. So to talk a little bit about some challenges, again, just keeping in mind, framing all of this, that these are meant to be an adjunct to Western medicine. This can become problematic when patients say, I want to try this alternative therapy, and risk delaying the treatment for something that may be necessary to target early with a Western therapy. So, but you need to pay attention to any type of interaction with medications that your patients may already be taking. Maybe there's interactions with the chemotherapies. A lot of these things that I read for something like an herbal medicine or non-herbals said to caution while you were taking any cancer treatment that you wanted to limit any potential interactions. Many of these approaches may not be FDA approved or regulated. A kind of a little bit anecdotal in evidence and everything. So, and it's important to keep in mind they're not without harms. A lot of them are very safe, but sometimes reactions can happen. So always something to pay attention to. And every patient has their own tolerance or acceptance for, as we like to say in FSP, the woo-woo. So everyone has a different level of woo-woo that they're okay with. Someone may like chiropractic, but someone may not and like acupuncture instead. So you really got to meet these patients where they're at, have that really robust toolbox so that you can introduce different ideas to them, but also cautioning usage of any of them. But as with the moxibustion, if a patient believes it's going to be helpful to them and it's not interfering with their cancer therapy, it's probably a good idea to give it a shot, because it may actually anecdotally benefit your patient, whether or not the literature supports it. So just finally, a couple of thoughts and conclusions. At UI Health, couple of things that are going on here. I won't go into great detail, but there's always robust research happening at the Cancer Center. I didn't dig into all the studies that are ongoing, but I know there's some exciting research in looking at acupuncture for controlling pain. So there are lots of options. If you want to know more about that, I'd be happy to give you some resources. And then Wellness House. Shout out to Kelly, who I know is here. And they provide a great, robust offering of services to our patients, things that include exercise like Tai Chi and yoga, anxiety reduction, nutrition, so everything that we're talking about. So we really like to highlight these services and encourage everyone to utilize them. There are some talks, some machinations of maybe developing some type of integrative medicine clinic at UI Health. If you're interested in this, we want to know. And I want to know if anyone else knows more about other services. I believe there is a pain service at UIC. I didn't dig into that extensively prior to this talk, but I would be interested to hear from you as well. So just in summation, a couple of takeaways. So there is a rich history to this integrative medicine that has thousands of years of foundation for some of these practices that may predate any of the literature and may be beneficial for patients. A variety of these IM approaches can be really useful. But again, be cautious when implementing anything adjunctive. Having this broad toolbox can really help us to help our patients the best that we can. And again, meeting patients where they're at and offering them different methods to treat their cancer pain, their cancer fatigue, or whatever they may be experiencing is always beneficial. That's all I have for this talk. Again, I have many resources included in here. And here's a picture of me getting acupuncture. So I've been going to acupuncture for a couple of years. So I embrace the woo-woo. So if anyone has any questions, please feel free. No questions?
Hi, Deborah, it's Jan Kidieski.
Hey, Jan.
Thank you so much for a great talk. I just wanted to relay that my mom had really embraced a lot of these different, things that you described, and I used to poo-poo it, but now I guess I really should have woo-wooed it. But my question had more to do with, do you have any intersection with patients who are suffering from fatty liver disease that is converting to liver cancer? Yeah. So this is kind of a chronic disease that, leads to cancer, often results in the need for a liver transplant. And so the trajectory's got to be extremely demanding and long-term.
Right. Yeah, we are pretty aggressive with that. Any patient that we notice with the transaminitis, we will get ultrasounds and get them to the liver service. We've really great providers in the liver service that work with patients that really reinforce a lot of these the dietary principles. The Mediterranean diet can be incredibly beneficial for helping with fatty liver. Interestingly, increased coffee consumption is helpful with fatty liver.
That's good.
Yeah. Very good for all of us, right?
Yeah.
So it is something that we have thought about. I don't have many patients with hepatocellular carcinoma that have gotten there, but I know we take a pretty aggressive approach to that to make sure those patients, get on track and are helping them to resolve their fatty livers.
Is there any work on preventative natural products that can help prevent fatty liver disease and fibrosis?
That's a good question. And I did not run across any. I'm not saying that there aren't. So that would definitely be something interesting. I'm going to write it down and look it up, and I'll see if I can't find anything and include it for you.
And part of the reason I'm bringing this up is because Jason Eng, who's a GI research fellow in my lab, is developing evidence in a preclinical model that very low dose of lenvatinib, which is a VEGFR3 inhibitor, we're finding maybe 1/5 to 1/10 of the dose that would be found in human treatment of cancer, that low dose might be able to prevent the progression of fibrosis in a fatty liver model. So it may be a repurposed small molecule for preventative purposes, but it's a chemical inhibitor, right?
Neat. So. Very neat. Wow, thank you, Jan. There are a couple of questions in the chat here. Might the integrative medicine program include psych-onc, mental health support? Thanks, Alam, for your question. That's a great idea. And I didn't hit on that. That's something that I could have definitely included, especially at Mouse Square with our cancer survivors. We have very robust behavioral health services. And then I know Anna Gordon is here. We can branch to the OCC, to the social work program there as well, to kind of bring that all together. So I'm also going to make a note about that. Okay, and then Miriam, you said in palliative care, square breathing, you use it all the time. Great. Excellent, Miriam. And yeah, Dr. Yanshow, I'm not sure if anyone if there are any integrative trained providers besides us at UIC, maybe a kind of a zebra here. Reserve.
I think it'd be great, Debbie, to just get a list of these kinds of resources, either within UIC and outside of UIC. I mean, it's to refer our patients to, that we could provide to the entire group. I mean, you and I did a faculty development course. We're not technically like fully trained in integrative medicine. It'd be great to see if there's some experts. I'm sure there's some experts in mindfulness and, but putting together a list of those resources and identifying those and inviting them into this group too might be really helpful.
Yeah, definitely the Wellness House. And then Tamara, thanks for bringing up YAS, being a really great program for young breast cancer survivors. So that's a really nice idea. I sometimes refer patients to my acupuncturist or, to the Osher Center or to a functional medicine doctor that I know very well. And I know there are also close by colleges and schools as well. The National University of Health Sciences offers some coursework and things. I know they do some naturopathy, which I didn't include because there wasn't really good research for any of it. So there's a lot of different options to talk about those things.
Debbie, do you think we could give Kelly Mitchell just a chance to kind of talk about some of the resources that are related to this through wellness? I know a lot of people know about these, but maybe not everybody, and I would love to hear from you.
Kelly, can you tell us a little bit about Wellness House and what you guys find?
Thank you. I was actually typing in the chat before you mentioned us at the end, because
Perfect.
Dr. Manst, as you were talking, as you all know, it's so much in alignment with the holistic approach at Wellness House. And we have programs around just about everything you talked about: mindfulness, meditation, mindfulness-based stress reduction, yoga, qigong, tai chi, nutrition, even singing bowls and immersive sound therapy. And when we're in person, we do have acupuncture at Wellness House too, and we'll return to that hopefully sooner rather than later. But that's all there for people, your patients, and it's all free.
Great, that's wonderful. Yeah, we can't wait. We're working with Wellness House, trying to strategize how to bring that back into Miles Square and bring that service to our patients. So very, very excited about that. Shout out to Candace. A year ago, I started meditating and adding Tibetan singing bowls to my day, and it has been extremely helpful. Is that after we talked about it, Candace, in clinic? In addition, you started Buddhism. Yeah, this is all just great stuff. I talked to many patients about it. It's all very accessible, right? It's, our patients, wherever they come from, whatever they're doing, can do a square breathing, or can, usually muster up, or we can try to figure out, muster up $20 for them to get a singing bowl.
Hey, I'm back. How are you, Geneva?
Oh,
okay. Oh no.
Zeta, Stuart, can you please mute? So yeah, I think you're still on. So any other questions or comments, anyone?
Yeah. I
can mute her. Okay. Can we discuss an integrative medicine conference? Sherry, there is, I meant to include in one of my final slides, there is an integrative medicine conference, and integrative medicine organization called Integrative Medicine for the Underserved. And they have conferences that kind of travel around the country. First one I attended was here in Chicago, and then I attended one in Washington, DC, and I actually presented a poster there during residency on food and nutrition. And so I'll definitely include some information on IM4Us, but definitely something we can discuss more, maybe bridging with Northwestern as well and providers there. So it's a great idea. So again, sorry.
Deb, this is Alam. Sorry. That's a great idea, Sherry. So if the IM conference is from the vantage point of the providers, perhaps if we can do one that actually elevates the participation and the voice of the survivors, and what works and what doesn't.
Yeah, getting survivors involved with that definitely would be a great way to frame it. Okay, we'll start those talks.
Debbie, you had looked, I'm sorry if you mentioned this already, you had looked a little bit at whether there were acupuncture services within.
I don't know of anything at UIC. Again, once Wellness House is back in person, we'll be able to offer some of those services. Right now, I only have had a handful of patients that have been kind of interested in it, and I do refer actually to where I go to acupuncture, because it's a little more affordable than a lot of acupuncture. It's kind of an access kind of issue too for people.
Traditionally, at many institutions, it's available through like the pain clinic, and I don't know whether we should explore whether those services might be there and we just are not aware of them, or if anyone on the call today is aware of that.
Yeah, I would love to know. So I need to give them a call. I just didn't get a chance before the talk. So definitely something to explore, because I'm not sure what all services they provide there for patients. But we're always trying to think outside the box. That is probably our number one alternative methods, pain control. We want to have the biggest toolbox around that, and from anything from anxiety reduction with a singing bowl, or, you know, trying acupuncture, or, you know, always the more recommendations you can pull out, the more likely your patient is going to respond to one, right?
Hey Deb, there was an email some time back, some years ago, that was sent out to the university regarding community health workers. Angela up in school base may know how she did that, but that was a call to action to find all of the community health workers. So if you want to try to find anyone that has integrative medicine fellowship interests, etc., that would be a way to do it, to kind of grab everyone.
Yeah, can you shoot me an email?
Will do.
Thank you so much.
Hi Deb, this is Hong Jane.
Hi, Jen. How are you?
Yeah, I'm a postdoc here at Cancer Center. So I just want to mention, let you guys know that I'm going to conduct a feasibility of acupuncture to reduce the psychological symptom cluster, usually compromise of chronic pain, fatigue, insomnia, and depression, anxiety among breast cancer survivors.
Nice.
So yeah, this study is currently under IRB review and PR.
Yeah, I saw the grant that Dr. Dornbos just got approved in October for studying acupuncture in the use of sickle cell pain. So, but I hadn't seen about the breast cancer patients one that you're doing. So great, keep us posted on that.
Okay.
It'd be great to feature some of the research that's going on at UIC around some of these integrative medicine techniques, especially for cancer survivors. So, it'd be great to feature your work. I mean,
sure, thank you. So I right now we are so in the fall we are going to start to recruit 15 breast cancer survivors. We've offered them free acupuncture treatment for 10 times. And I think this is also a good resource for patients to experience like acupuncture as well.
I completely agree, because that's one of the ways we sold it at Northwestern. We actually had some meetings and had all the providers come over and sample acupuncture, massage, was Reiki, naturopathic medicine.
Great. Yeah.
And for those who are interested, there is, through the Osher Center, what Debbie and I both did was a faculty development course in integrative medicine. It doesn't necessarily teach you how to provide the services, but it makes you a lot more aware and in a lot more detail. What Debbie did sort of comprehensively today is covered over a course of about 8 months, once a month on Fridays for a full day. It's a great course, and I can try to post in the chat before this is over a link to that if you're interested. It is a very good and comprehensive training.
Yeah, really immersive. Okay.
Great. Well, thank you, Debbie. I know we're past the 10 o'clock hour. This was a wonderful presentation. I look forward to more presentations, especially that highlight some of the work that's being done at UIC, and we'll try to pull together a list of resources and trainings, and hopefully an integrative medicine conference. So thank you for that suggestion as well. And we'll look forward to seeing everyone. Debbie, do you want to announce the next date and the next speaker?
I meant to open up where I'm trying to juggle a little bit, because we might want to have our next speaker to be Dr. Bento Suarez, who is a PhD in cell biology and genomics, who has shifted his career focus to compassion and empathy in cancer survivorship experience. But I may need to do some juggling. So if Anna's still here, you may be on deck. But that'll be next. We are switching the survivorship lecture series to monthly, which is what I wanted to start with initially. But so we have a little more capacity to do that now. So hopefully we can check in every month then and have these talks on topics in survivorship. All right. Thank you so much, everybody. Have a wonderful Memorial Day weekend.
Thank you, everyone.
All right.
Thank you.
Thank you. Great conference. Great talk.
Thanks, Lon.